Next, we have Jose Manuel Besares Lopez. Now I know why they asked me to moderate this morning. Is a global health consultant from Tabasco, Mexico. Orgullo Hispano! After attending the summit last year in The Hague, he has gone on to lead one of AstraZeneca's flagship community health programs, and he also manages to lead the One Young World community in Central America as a coordinating ambassador. Please welcome my friend, Jose Manuel.
Good morning, everyone. Hola. I'm Manuel. I'm a young scientist and public health consultant from Tabasco, Mexico. I stand for global health, putting children and adolescents first, since the science has confirmed us that it's the most effective to prevent infectious and non-communicable diseases during the earliest stage of life. This is my passion. This is what I believe. This is my goal. As a young leader, I love to use the power of my voice. For more than 8 years, I've been advocating for better health promotion among adolescents and young people in my community, in my country, and now to the world. Back in 2013, while I was visiting vulnerable areas in my country, I realized that young people weren't considered at any healthcare decision making. In the same year, I learned about One Young World, and I realized that this global network was the right platform to share the importance of this unmet need. From that moment, I've tried every single year for 5 years until I got to One Young World 2018 after receiving a highly competitive AstraZeneca Young Health Program scholarship. However, when finally I met this dream, I felt it was my best moment. I was a recent master graduate in public health who had spent nearly a year looking for a job. I was really anxious and truly depressed. I wanted to make a change, but I didn't know how to start again. But once I arrived to One Young World, everything changed. During one of the breaks at the exhibition center, I met Helen Sabel, AstraZeneca Global Community Investment Associate Director at their booth. I was surprised that I could talk with a senior executive of the health industry so openly. And then I asked why Mexico didn't have a young health program yet. She smiled, as always, and she asked me if I would like to be part of the program. Of course, I said yes. I was thinking that the opportunity would be another great volunteer experience. But I was wrong. This turned to be my first job. But most important, it became the opportunity to shape and implement the Young Health Program in Mexico. It's amazing. I really appreciate this opportunity. So, the Young Health Program, or YHP, is AstraZeneca flagship global community investment. It's a global disease prevention program, and it's focused on providing research, information, awareness, and promotion around the main risk factors of the most common non-communicable diseases, like cancer, diabetes type 2, heart disease, and respiratory disease. The program was launched in Mexico this year, and it's based on a collaborative model between AstraZeneca Mexico and 2 NGOs, Project Hope and Yo Quiero, Yo Puedo. The program will run from 2019 to 2021 with a new investment of more than $1.5 million by AstraZeneca. And I'm responsible for bringing the youth perspective into our most important community program, building employee engagement opportunities and acting as a liaison between our charitable partners and the company. Now, we are involving our colleagues from AstraZeneca Mexico by focusing on NCD prevention and adolescents' health. Last month, we started our first YHP club for peer educators focused on reach the vulnerable youth of Iztapalapa in Mexico City. And we hope to reach 46,000 adolescents with key health message in the next 3 years. Last week, we feel the power of this program, and we visit the schools in the community to implement our first voluntary activity with our colleagues as part of the Patient Week for our company. This is how we are creating a new approach, a new sense of purpose that we have as a pharmaceutical company. Clearly, I love my job in AstraZeneca. I work for a global science-led biopharmaceutical company that promotes access to healthcare in a new frame and a new meaning, from prevention to treatment, creating balance and changing lives. And I'm proud to say this, I'm transforming my professional expertise into a positive change to benefit young people. And this is a clear example of how your role as a One Young World ambassador could be an opportunity to increase your impact as a leader, not only as a young leader, but as a true leader, and I'm quite thrilled now. Because this is a reminder to you that has arrived as a delegate of your country, and to every dreamer, that you are always influential when you use the power of your voice. That you can leverage your role at the company that you work for, that you can lead the most amazing and influential initiatives. As the One Young World Coordinating Ambassador for Central America, I really want to tell you, don't be afraid to be the change. And to the companies, don't be afraid to listen to your amazing young leaders. And from my experience, I'm confident that future leaders are shaped by the strength that they demonstrate when everything looks adverse. I use my scientific knowledge to generate a social impact. And I went from working with young people in the most vulnerable areas in my country to leading the most important young health initiative of a pharmaceutical company in Mexico. If I did it, you can do it as well. Thank you so much.
Well, I'm ready to adopt you all.